Did you ever hear of this abnormal blood clotting disorder? The name is factor V Leiden and protein C deficiency under a big umbrella called thrombophilia. Yes, blood clot has taken down the strongest of the strongest me and you know. So when it comes to clotting disorders, I need me and you to pay close attention to this conversation. It's very crucial. Well, what are they? A genetic change in the factor V protein that makes it harder for your body to stop forming clot. This means your body is more likely to form clot even when it is not needed. That is factor V Leiden. Is very, very important. And then when you hear of the word protein C deficiency, this is when your body doesn't have enough protein C. So understand that the word protein C, it does a job to help prevent too much clotting. So your normal protein C levels are between 65 and 135. So meaning if they are lower than 65, what is going to happen to me and you, our body will start forming unnecessary clot. Very important conversation. I need you to understand these two. Factor V Leiden, protein C deficiency is very important. And a few people have asked me, how do they affect the body then? Well, let's talk about it. Factor V Leiden makes your clotting system overreactive, whilst protein C deficiency removes a natural brake on your clotting levels. Pay attention to this conversation. With that being said, the combination of factor V Leiden and protein C deficiency can lead to excessive blood clot formation because the body's natural balance is lost. It's completely lost. Your body is going to unnecessarily start making too much blood clot for no reason. This means the blood clots may form unnecessarily, even without us blocking our veins, our arteries, even without us having any injuries. The blood clots unnecessarily keep forming. Pay attention. So, such a condition has put a few of our loved ones into critical issues like deep vein thrombosis, like pulmonary embolism, stroke, simply because it wasn't managed well. Very important. This condition is genetic. It runs in families. Now, a lot of people also don't know that they have it too. So it runs in families, and then also some people have no idea that they also have this condition we're talking about. So if that's the case, then let's monitor any symptom trying to creep into our life, into our body. It's very crucial, it's very important. What are the symptoms me and you can pay attention to or can be on the lookout for? When you see swelling, when you see pain, when you see redness in one of your legs, it's very important to pay attention to that one. Shortness of breath, chest pain. If one clot travels inside your lungs, pulmonary embolism could happen. It is going to happen. It very, very, very is important. Abnormal clots in unusual places like your brain, your liver, please pay attention to those things. Now, the doctor is going to diagnose me and you. He's going to do blood tests. This blood test is going to check for factor V mutation, or if your protein C levels are below the levels I gave you up there. Very important, because once the protein C levels go lower, your blood, my blood, is going to unnecessarily start clotting too much. Doctor is also going to look and check into our genetic history, family history, to track and see any potential past clotting events that happen to our family members. How is the doctor going to treat me and you? He is going to put me and you on blood thinners, anticoagulant. This helps to prevent or treat any clotting disorders. And also, let's pay attention to any unnecessary lifestyle behaviors that we keep doing, like staying sedentary for a long period of time is going to cause me and you unnecessary obesity. We have to stop smoking. I always talk about the word smoking. We also have to stop sitting down for longer periods of time. We manage our weight. We hydrate more. We drink more fluids. We exercise daily. 30 minutes, 40 minutes, 45 minutes, 4-5 times a week is very important. We move around a lot. Please pay attention. Moving around a lot, you drain, you burn, you shed a lot of fat. That will help you. We eat healthy. And I want you to understand the obesity I was talking about increases the risk of you getting unnecessary blood clot. Now, can a person have both of these conditions? Is very crucial. Yes, a person can have factor V Leiden. A person can also have protein C deficiency. They are both going to increase clotting risk even more. In those cases, careful monitoring, preventive measures are the major key to surviving those issues. So I need you to remember these two conditions. They are both inherited and they both make the body easily clot for no reason. Let's take our time, let's pay attention, let's monitor, let's know our risk that could cause us these factor V Leiden, protein C deficiency. Let's adhere to every treatment the doctor is going to give us. That heparin, that warfarin, that Eliquis he gives me and you, we should take them. These are blood thinners that will help our body and our blood not clot unnecessarily when we don't want them to clot. I need you to pay attention. Complications are severe when you don't pay attention to what is happening now. My name is always Nurse Solomon, and I'll see you soon.